I'm Dr. Marvin. This is the You Be the Dentist series. We have a cracked tooth. So there are many types of cracked teeth. There are some that are treatable and some that are not. And don't confuse a cracked tooth with a fractured cusp or a fractured tooth. So this picture right here will show you what I'm talking about. So in this particular case, this person came in, said that a filling came out, and in reality, the tooth just split, and there was not a previous filling. See, when you have a filling, it actually makes the tooth weaker and is more likely to fracture. So you may hear a lot of dentists calling out or seeing teeth that are cracked, and they will recommend treatment. The typical treatment is usually a crown or a root canal or an extraction. And in this particular case, we have a split tooth that goes all the way down the root. He had some pain, and the pain went away. So the crack went into the nerve, the tooth died, and now the question is can we save the tooth? In this particular case, we cannot. I'm recommending to extract the tooth. And if we extract the tooth, clean out the infection, we may or may not be able to do an implant depending on if he's a candidate or not. In order to determine if he's a candidate, we need to see if the bone is healthy, we have to see if he has enough bone, and then if he's compatible with the dental implant material. So that is the cause, well, that's the treatment. Now let's go back to the cause. The cause of cracked teeth really is a poor bite. So if the teeth hit too hard, you have a wedging effect where the tooth on the bottom goes right in the middle of the tooth on the top and it wedges the tooth. So it's not necessarily due to grinding. Grinding can contribute to it, but if the bite is off or the tooth hits too hard, then it could fracture, and then all it needs is one particular large blow to the tooth. Let's say you're eating some almonds or biting on some ice, or if you're grinding so much that the tooth fractures. So how do you avoid that? You get your bite balanced. So bite balance is something that we do at the office, which is very common or very necessary for a lot of patients, about 90% of them. What we do is we get their body adjusted, get that aligned, and then we adjust the teeth and balance out so that all the teeth hit exactly all at the same time. So that is the bite balancing procedures. That is the solution to cracked tooth syndrome and to a cracked tooth, because if you had one tooth that fractured, then you may have another tooth that does the same thing. So make sure you get your bite balance, or another term is occlusal equilibration, but most dentists don't know how to do that. So if you wanted to have it done at my office, call our office 760-536-1199.